Yeah, so TRANSCEND FL is a single-arm phase 2 study looking at Lisocabtagene maraleucel, which is a CD19-41BB auto CAR-T cell therapy for relapsed refractory follicular lymphoma. Now, clearly CAR-T has transformed how we approach large cell lymphoma, but those patients' outcomes are so poor, it's an easy discussion to have when CAR-T is appropriate. I think it's much harder to define the patient population where you would consider a resource-intense, potentially toxic therapy in indolent lymphoma, where most of those patients are going to face normal life expectancies with the available treatment options. So this is a single-arm phase 2 trying to explore different cohorts of patients where you could make an argument that CAR-T could potentially be impactful. So second-line patients who progressed within 24 months of chemoimmunotherapy or have GELF criteria. And then we have a third-line cohort and a fourth-line cohort. So at the summer meetings, we saw the safety for all of these patients, and then we saw the efficacy reported for that third-line or later cohorts. This year at ASH, we're going to see the second-line safety and efficacy data, and also kind of compare and contrast that a little bit with those third-line or later patients. Again, it's not a randomized study. There wasn't matching in those baseline characteristics. They're clearly going to be different for patients that are enrolled at an earlier time point, but it looks like those outcomes, particularly for those POD24 patients in second line, are quite favorable. So I'm excited to see where the future goes. We're anticipating an FDA approval for liso-cel. We don't know exactly what the patient population is going to be, but the randomized phase 3 is now launched, which is liso-cel versus standard of care, second line, third line, or fourth line patients.